Hello, this is Jamie White with Supplierty News. Today we're going to do something a little bit different. As most of you are aware, the CBO has just released its projections as it pertains to the Affordable Health Care Act, or quote unquote Trumpcare or Ryan Care, named after House Majority Leader Paul Ryan. Um, Essentially, the new healthcare plan that will be in replace of Obamacare. Now, the CBO stands for the Congressional Budget Office. They are a nonpartisan organization, so let's keep that in mind. Nonpartisan that essentially looks over the the plan or the legislation in place that Paul Ryan, the leader of this new health insurance plan, has created, just to see exactly how it would affect not only the budget of the government, the federal government, but also things such as how many people will be insured, if their premiums will increase, decrease, et cetera, et cetera, et cetera. Um, Now, the one thing that I think is really important that we have to talk about when discussing this, before we get into the CBO's new projections, I think we should just highlight their old projections of Obamacare. Now, excuse me, and looking at the projections for Obamacare, let's make one thing very clear. Uh, they were right about some things, but they were also wrong about some things in their projections. The two big pieces that they were wrong about were the number of people who they estimated were going to be insured and uninsured, as well as the costs. Well, I guess three things, because in addition to that, they were also wrong about the profits healthcare companies would be making. They projected that healthcare companies would make a lot more profit than they ended up, and the reason being is because they thought a lot more people were going to be insured uh, than actually were insured. I think some projections had it as they had the projection was 120% more than what actually or the amount of people that actually signed up. So when looking at that, us keep that in mind that the CBO, they're not God when we're talking about these estimates. They are, people in a room projecting and calculating what this could mean. So these are all estimates based off of the information that they have at hand. Now, even though I've said that, about some of the things that they were wrong, they were also right about or very very close to things such as the estimated cost it would take for Obamacare to be in place, by 2016, in terms of the effect of the budget. So they were pretty close in that. But again, they're not God. They're making projections based off the information they have at hand, and they do a pretty accurate job considering. Nobody's going to be 100% right when you're dealing with this type of information, but it really gives you it gives you an idea on where we're going to be around. So somewhere within that area. Now, another thing that you have to keep in mind when discussing their projections about Obamacare is that nothing like this had ever happened before. So the projections that they made were basically coming out of not thin air, but out of their best guesses um, when it comes to creating a budget for a health care system like Obamacare. So because of that, obviously numbers were going to be off, which we saw. I'm not going to get too into specifics because if I did that, we could be here for 40 minutes at least, an hour just discussing specifics. But I just want to keep it very broad. So they're wrong in some areas, particularly how much money healthcare companies were going to make, the number of people who were going to be insured, as well as the cost. The cost ended up being more or rose more than what they projected, and that's because less people signed up. Again, the key here is less people signed up than they projected. So that's where we're starting with Obamacare. And again, they made those numbers because they didn't have any past experience uh, in estimating numbers for health, almost not universal healthcare, if you will, for lack of a better term, but just government sponsored, I guess healthcare would be a much better term actually. But so that's where we're starting from Obamacare. So when you're hearing things such as they're 100% CBO, you can't trust them, or if you're hearing things from the left that are saying CBO was a lot accurate. They were more accurate than what they're given credit for. Always remember that it's usually the truth is usually somewhere in the middle, and this one it's especially somewhere in the middle. Right about some things, wrong about other things. It is what it is. But take this away that the CBO is the best resource for trying to figure out where if this can work or not. Now, in taking that information, let's go ahead and let's talk about the Congressional Budget Office's projections as it pertains to the new, Ryan Care slash Trump Care. Uh, the projections just came out today, a couple hours ago, or maybe even an hour ago or so. And what they're saying is that 14 million people are likely to lose their coverage by next year if this is implemented the way it has been presented, with up to 24 million people losing their coverage by 2026. Now, essentially, what that means is more. I think Obamacare helped about 21 million people, new people become insured. So what we're looking at is if this stays in place in about 10 years, even less people will be insured than in 2010 when Obamacare went into action. So it would actually, if you're doing the numbers here, it would actually be 3 million less people would have insurance. In addition, they're talking about how the deficit would actually shrink under the new Trump care, which is positive. But unfortunately, the reason being is because there would be less people having insurance. So less people paying for it, obviously, it would decrease the federal deficit. Despite what people are saying, and I think that's key here. I know, especially President Trump makes a really big piece about this, about how Obamacare is going to fail, it's going to die, yada yada yada. In the long term, he's correct. That can happen. Now, that would be less because Obamacare isn't working, and more because President Trump just wouldn't support it the way that it needs to be supported. So he is right that it would fail eventually on the long term, and by long term, we're talking about 5+ years. And again, that's more so because he just wouldn't provide resources to support it. Which, if you think about that in any department or legislation, if you don't put resources to support it, it's going to fail. So President Trump is right. However, it's kind of a technicality in that piece because according to the CBO, if you input the new Trump care or if you just keep the Obamacare and you allocate resources to it, it'll remain stable. Whether we can always, there's room for debate in terms of how stable it can be. Is there better options? Obviously, but in terms of people having healthcare and moving forward, it'll be fine either way. However, when we're looking at premiums, here's a really big one and a very interesting piece here. Is it says that premiums in the individual market would increase in 2018 and 2019, but then they would fall after that. Now, the reason why these prices are falling and the reason why the deficit is falling is because less people will be enrolled. So let's say this does get passed, and 5 years from now, we got a decrease in federal deficit as well as people's individual markets or and not markets, but cost has decreased. Republicans can definitely promote this as, hey, we've helped decrease the budget, and now people's premiums are lower. Uh, now, although that would be true, what you also have to take into account is that less people will be insured, and the big the big piece here is that we have to make sure that more people are being insured while also taking into account the budget. So I think Rand Paul actually said something about this and how if you're trying to make this work as a business model, you're gonna have to excuse me, you're gonna have to decrease the amount of people who have health insurance. It's just something that there is no way around that. And again, if you're looking at this as a business model, and it seems as if this is what Republicans are looking to treat this in order to solve this, is if you look at it from a business model, to ensure that healthcare companies are making more of a profit, as well as we're seeing a lower cost and premiums for certain uh, individuals seeking healthcare. What you're going to have to do is create again a business model where less people are insured. Now, again, I already talked about this and how the projections could be right or wrong, but what we can say here is that this is not CBO's first time projecting something like this. So I do believe that these numbers are going to be a bit more accurate. Now, of course, this is the information that they have now. They can't project changes in the market, 3, 4 years from now because we just don't know. But I do think that this is a really good base in terms of where we need to look at. So we're probably looking at somewhere between the 10 and 20 million range in terms of people who are going to fall off. And we know people are going to fall off. That's an absolute certainty. Now the question is just how many. And I do believe, based off of these new projections, that it's going to be at least 10 million. Now, the solution that's going to come to this, maybe uh, President Trump has said that he's open to negotiating. This seems that this is the start of negotiations, which is, at least 10 million people are going to fall off. So now we have to figure out ways to essentially keep them on while lowering the deficit and making it cost effective for Americans. I think the bigger issue here as well is, and this comes into an ideology piece, which is, do people have the right to health care? And some people say yes, about half and half. Some people say yes, some people say no. But the bigger piece here is, if I have to pay more money, but that ensures 20 million more Americans, will I do it? I think that's a really big question. And what we're saying is, well, pretty obvious that especially our Republicans are essentially saying no, that even if people have to, if you're paying more money, but that ensures 20 million Americans, that's there's another way to do this. And essentially what that means is it's better for you to, decrease costs if lesser Americans are insured. Of course, they're pushing the whole, hey, it's your choice. You can get insurance if you want, but not everyone should have insurance if they don't want to, which I completely agree with that. However, I think they're twisting that argument because I do not believe that 24 million Americans are just saying we don't want insurance. I'm pretty sure that there's a bigger reason for that. Now, obviously, another the last thing that I want to talk about, and again, I don't want to get too in depth on this, but the last thing I do want to talk about is that as you get older, your premiums will increase, and that's going to be tough. Now, obviously, that's how it is right now, but it's going to be a more significant increase. The good thing is, if you're younger, it's going to decrease in terms of the premiums that you're paying. You can stay on your parents' healthcare plan until you're, I think, 26 or 27. So they're going to keep that in place, which is good. And when you're 27, if you're healthy and whatnot, it's going to cost you a lot less. But because of that, so currently in Obamacare, the reason why you have to pay a lot when you're younger is because you're pretty much paying for the older generation who are sick and do have health issues. So that's why it's a little bit more for younger people who are in the workforce, supposedly in the workforce, are making money so they can afford that, so that they can pay for people who are older. And with this, what it does is it decreases the younger generation's amount they have to pay. But because of that, that's going to also, that's essentially why you're taking off a lot of people who are older because they can no longer afford to stay on these plans. Um, so that's essentially where we are right now. Hopefully, and obviously, this is just a starting point in terms of negotiations for healthcare. We're going to see a lot of changes as we did with Obamacare, and then we're going to see CBO probably take that legislation, do different projections, and then we'll kind of go from there. The one thing that I do want to say, and I do give Obamacare a lot of credit for this, is it essentially forced Americans to have the conversation about healthcare that we should have had 50 years ago, which is, Medicaid and Medicare are going to run out eventually. We have to create some type of solution that's going to benefit Americans going forward. And although we're having tough conversations now, these are necessary conversations so that 50 years from now, we have a solution that works for as many people as possible. It's growing pains, and this is just one of them. But I do think that there is a light at the end of the tunnel. At the end of the tunnel, I just wish that people from both parties would come together a little bit better in order to work this out. I wish they would have done it under President Obama. Unfortunately, that didn't work, and it seems like it's not going to work this time either. But hopefully, somewhere in the next 5 to 10 years, both sides can come to the table and really work this out. So Republicans turn to figure out a health insurance plan that works. It seems, as of right now, it seems as if this is similar to Obamacare and that it's not going to work long term for both parties. So we'll see what they can do with it and pretty much go from there. If you liked this video, please like, subscribe, comment, tell me your thoughts, and thank you for listening. Have a great day.